Hello and welcome to the Quincy Access Television Studios. I'm Mark Crosby. Thank you for joining us for Your Health, a program that, well, helps to keep you healthy. Today's topic is oral effects of smoking and vaping. And we have Christine Kosha, who is the tobacco treatment specialist in the city. She's joined us to delve into this topic. So Christine, welcome back.
Thank you for having me back, Mark. It's nice to see you again.
Great to see you. We've done a lot of programs on smoking and the effects of smoking, the effects of vaping, and we've touched upon the oral effects, but this program is really dedicated to those effects.
Right. I think it's something that a lot of people don't put a lot of thought into, just the effects that smoking has on the mouth and some of the consequences that can come up surrounding smoking. And, you know, it's not just for cigarette smokers, but for people who use e-cigarettes and vape as well. The problems are there. We see more people with incidents of oral issues when they're smokers. They have more issues with their gums and their teeth, and there's that chance for smokers to have more of an issue with cancers of the mouth, oral cancers, the tongue, the lip, things like that. So,
and gum disease is right up there.
Absolutely, yes. Gum disease for smokers is a huge problem. One of the leading risk factors for periodontal gum disease is smoking, and that's always been a known fact. So again, people who've been lifelong smokers who've smoked for quite a bit of time, or they do tend to develop some sort of issues with their gums or their teeth.
And let's look at gum disease and I guess what it affects in the mouth. What are the effects of gum disease? Mostly on the attachment of bone and soft tissue to the teeth.
Exactly, right. So when you're somebody who's been smoking for a very long time, the chemicals, the tar and the nicotine, all of that, eventually they affect your gums in a negative way. And that's mostly what we see is it's affecting the way the bone and the soft tissue connect to each other. Nicotine being a vasoconstrictor, it affects the way the blood flows to the gums. Similar to what you would see again with somebody who complains about having cold hands and cold feet. The nicotine doesn't allow oxygen to flow freely, so that affects the gums as well. So sometimes when you have people that are heavy smokers that have had any sort of dental surgery or issues with their mouth or their teeth, it takes a little longer for them to recover because the blood isn't flowing the way it should, and that's usually due to the amount of smoking that they do.
Probably one of the most obvious to folks is the discoloration of the teeth.
Absolutely, right. Again, we all know over time, if you're a heavy smoker, that discoloration tends to happen to the teeth. It's mainly the nicotine and the tar. So, you know, you see that. And a lot of times with people that have been lifelong smokers, it gets to the point where that's very difficult to remove. So they would probably need to get some sort of a whitening treatment, but it's something that their dentist would need to address for them. But yeah, over time, that's a big issue for people who smoke very heavy.
I don't want this program to get too far in without addressing what is next to you on the table. And one of the things that stuck with me after seeing it for the first time was the discoloration of the teeth. So maybe we could move that
Sure.
into place.
Yes.
And we should mention also that the pedestal for this mouth is actually the top of a cigarette.
Exactly right. That's right. I don't think a lot of people notice that until we have it out on display. But yes, it's kind of sitting on top of a cigarette, so it's sort of emphasizing the whole idea of like how all of this stuff is happening and why it's happening. So it's the way it was made, I think, is very smart.
And I think what we'll do is we'll probably have my director kind of zoom in to this, so you can possibly tilt open the mouth and
Yes.
we can take a look at the teeth.
Right.
And while that's happening, we can also address other physical appearance, I suppose, altercations from smoking. And I know we had looked at this earlier, but difficult to see on this possibly, but it's the skin around the mouth.
Exactly. Yeah. If you get a closer look, you do see that on this model, just the small lines that form around the lips, on the upper and the lower part of the lips. Again, over time, this affects the look, it affects your skin in so many different ways, but for people who smoke heavily, you do over time start to develop those small lines, and that's from that constant puffing on the cigarette. So that's something that's very common. This model also has that small sort of lesion on the lower lip, which is sort of an example of a lip cancer. So as I mentioned, for people who smoke heavily or have been long-term smokers, their chances of developing any sort of oral cancers is pretty high. So we have mouth cancer, throat cancer, tongue cancer, things like that.
And there is no tongue on this display, and we had talked about that too. But let's talk about some of the effects on the tongue itself.
So the tongue, and I know I do apologize, there is supposed to be a tongue that, this is a very old model, but the tongue that came with this had an example of what's called leukoplasia. And leukoplasia are small white spots that develop over time for people who smoke heavily. They can develop on the side of the tongue or really on the side of the mouth, anywhere inside your mouth. You can see these leukoplasia lesions, and that's increased again for people who smoke heavily. So you see those. So the tongue that originally was with this had a small white spot on it that was kind of an example of what a leukoplasia would look like. The other thing that sometimes happens is something called black tongue or hairy tongue. It affects people, again, the heavy smokers. We have the bumps that we have on our tongue that usually, like taste buds pretty much, they are constantly ridding themselves of dead skin. So they keep themselves functioning by doing that. For people who smoke heavily, there's a buildup of keratin that happens, and it sort of affects those dead skin cells. They can't do their job the way that they normally do. So that buildup of keratin will tend to cause what looks like a hairy tongue. So some people, it can become very dark and it looks like hair growing on the tongue, and it's just because of those cells not being able to do their job. That's something that happens for people who smoke cigarettes and vape as well. So over time, if you quit smoking, that problem does correct itself, and the dead skin cells start to work again, and the keratin levels start to drop down. But that is certainly another thing that happens. So you hear that name, right? A black tongue, hairy tongue. It can be caused by other things too. There are certain medications that can sometimes cause hairy tongue, viruses that can cause it. But for people who smoke heavily, it can be one of the things that happens.
I guess we'll move our model aside now that we've addressed it. But that's great. You had mentioned taste buds. Are taste buds affected?
Absolutely. You will find for people who've smoked, lifelong smokers, people who've smoked for a very long time, they'll start to discover that food doesn't taste as good as it normally does, or as good as it would taste for somebody who doesn't smoke. That's because the taste buds, again, are affected with that buildup of the nicotine in the tar and the keratin that we talked about with the hairy tongue. And over time, again, when you quit, one of the nice things about quitting smoking is all of the things that take place after you quit. Your body is very resilient. It can respond. It can become healthier as soon as you stop smoking. So people over the weeks when they quit, over the weeks and months after they've quit, they start to discover that they can taste things better, taste and smell. So people will find that things smell better, things taste better. So food takes on a whole different meaning for people.
Which is encouraging, right? Because if somebody is smoking and they think, oh, I've been smoking for 5 years, why give it up now? They might not be aware, and probably aren't, because of that comment, aware that things do improve.
Exactly. I think a lot of people are under that impression. They think they've been smoking their entire lives, or a good part of their lives, that the damage is done and why should I quit now, that sort of thing. You're absolutely right. But just about everything that happens when you quit smoking, when you are a smoker, as soon as you quit, improves itself. Within the first 10 to 20 minutes after you quit, things like body temperature and pulse rate start to drop down, and then the bigger things start to follow. Your lungs start to clear themselves out pretty quickly. As I mentioned, taste and smell start to improve. Circulation, for people who have issues with that due to smoking, people just find that they're able to walk better. They don't have as much cramping, and that again is associated to the nicotine restricting the blood flow, and just energy levels overall. So yeah, people just need to know it's never too late to quit, and no matter when you decide to do that, the changes will start to take place immediately.
Now, this was interesting for me, I hadn't realized, but it makes sense, that tartar buildup has an increased chance of building up if you're a smoker.
Exactly. Yeah. So as we talked about, again, people who are lifelong or heavy smokers, they tend to see that build up over time on their teeth. So, even in the model that we were just looking at, that would be an example of somebody who's been smoking for a long, long time. So you have the nicotine, you have the tar, and then just all the chemicals that are included in the cigarette. So over years and years of being a smoker, that's going to have an effect on your oral health, especially your teeth. And as I mentioned, some dentists will tell people, like, it may get to a point where it may not be possible to clean that up. They can probably do some work on it, but it may not come off completely.
Right, so tartar-controlled toothpaste probably doesn't touch it much.
I don't think might help slightly, but I think the best thing would be to quit smoking. And as I said, and we talked about in the beginning, I think people just don't always realize the oral effects that happen. And sometimes when people are smokers, they don't always pay attention to what's happening to their teeth and that sort of thing, because we do have to keep in mind that smoking is an addiction. So even if people are aware of it, they're still unable to stop.
Well, let's talk about something that a smoker might not be aware of, but somebody else certainly would, and that would be bad breath.
Exactly, right. Same thing. It's the things we talked about that affect the keratin that builds up on the tongue, that causes the hairy tongue, that sort of interferes with the taste buds and how they do their job. That can also create bad breath. And again, it's the chemicals, the nicotine, the tar, all of those things affect the breath the way they would the taste buds and other parts of the mouth.
I suppose during an oral exam, some of these are discovered. Some, like the sore on the lip, certainly would be discovered by the person themselves.
Oh, absolutely. Yeah, I think I would assume that most people that are smokers, anytime they visit their dentist is going to tell them about all the things. I mean, a dentist can't be fooled, so they're going to know if you're a smoker, and they're likely telling people to quit all the time. And there were just a lot of things that are affected. And as we talked about before, if you're somebody who ends up needing dental surgery for some reason or another, your recovery time is going to be longer just because of all of the effects and just the way that the blood isn't flowing the way it should, and the way that your gums are affected and constantly inflamed, that sort of thing.
Let's look at this fact. About 90% of people with mouth, lip, or tongue cancer use tobacco. Smokers are 6 times more likely than non-smokers to develop these types of cancers.
Exactly right. So, I mean, while it is true that people who don't smoke can certainly develop these types of cancers as well, but it's a greater chance when you're somebody who smoked. I think we've all known somebody in our lives that's been affected by smoking in one way or another. My dad was affected. He had throat cancer, and he went through all of that. And even though he had quit smoking, and it's just, I think that it really doesn't matter. That's what I'm trying to say here.
Well, I think in some cases the damage has been done, but that shouldn't be a reason to not stop smoking, because
exactly.
In other cases the damage hasn't been done.
Exactly. As I mentioned, most things they can repair themselves when you quit smoking. The only thing that is irreversible would be things like lung cancers or emphysema. Even when you're diagnosed with emphysema, there are stages to it. So yes, when you're diagnosed with it, you do have emphysema for life. But the good news is if you quit smoking right away, it's not going to progress.
It's manageable.
Exactly. I think the people that we see walking around with oxygen tanks, there's a good chance that they were told many times by their doctors that this will likely happen if you continue to smoke. And so, but again, keeping in mind that it's not an easy thing to quit, and some people it's a difficult thing.
We often, well, you would know this because you came in and recorded, did a voiceover for something that's called the 4 Ds.
Yes.
Just talk about that, I guess, certainly in relation to, it goes beyond oral
Right.
Cancers and oral ailments, but it's great for smokers to just use that as a guide to quit.
Exactly, right. The 4 Ds have been around for a long time. We go over them with people when they're thinking about quitting or choosing a quit day. The 4 Ds include drinking water, Drinking water is excellent when you're trying to quit smoking. It helps to flush everything out of your system faster. And of course, water is great for so many other reasons too, for your skin and just for your overall health. So drinking water is one. Deep breathing is another one. If as I tell people that are trying to quit, if you were to take 3 to 4 deep breaths, hold each one as long as you can, and then slowly release, you're almost going to feel as if you did go out and have a cigarette. Because if you think of it, what you're doing when you're smoking is inhaling. So deep breathing is the same thing, but you're bringing in nice, clean, healthy air as opposed to all the sort of junk that you're getting from the cigarettes. Delaying is another one, what part of the 4 Ds. Anybody who thinks about having a cigarette or they develop a craving, if you just say to yourself, I'm going to put this off as long as I can, delay it instead of giving in to the craving right away. On average, a craving lasts no longer than 10 minutes. So if you can get yourself to just in that mode where you say, okay, I know after 10 minutes this craving will pass, so let me just delay as long as I can. And after 10 minutes, usually that craving will go away. And then the 4th D is do something else. Anything you can think of to keep your mind occupied so that you're not sitting there thinking about smoking. So getting yourself up and out of the situation that you're in is really key. If you're sitting at the kitchen table and a craving sets in, get up and go outside, get some fresh air, just go into another room, maybe pick up a magazine or do some light cleaning around the house. Anything you can think of to keep yourself distracted, just doing something else.
We've been talking about pretty much traditional cigarettes mostly, but let's talk about e-cigarettes and vaping.
Right. I didn't want to not mention e-cigarettes and vaping today because they are the people who smoke and e-cigarettes and vape. They also have that chance of developing cancers or gum and lung issues, gum and teeth issues. I'm sorry, and it's not something that's strictly for people who smoke cigarettes. So I like to just make sure that people who smoke e-cigarettes and vape are aware that they're at risk as well. So it's just, it's something else that over time, some of the chemicals that are included in vapes can cause issues.
Right,
Yes.
the fluid can restrict blood flow.
Yes, they have, just for an example here, we have propylene glycol, benzene, formaldehyde. They're just some of the chemicals that are found in vapes and cigarettes. Those things are found in regular cigarettes as well. But we are seeing these things show up in vapes. And so over time, I think we're just going to start to see more and more of these chemicals, the things that we know about now, but I think over time we're going to learn about some of the things that we don't know about, or new things that they're going to try to add. So these are the things that cause issues for people just with those oral issues that we talked about.
And I guess, and I know we've talked about this in prior shows, but that oral fixation, the cigarette, the e-cigarette, the cigarette,
Right.
The vaping product in the mouth, the tactical aspect of that, you could chew on a toothpick.
Right.
You could chew gum in place of using these products.
Exactly. There are so many other ways to fill in that if that's something that people miss. A celery stick, a carrot stick, a straw.
That's healthy, absolutely healthy, right? That's the other side.
Right,
Yeah.
right. And with things like that, if you're using a celery stick or a carrot stick, you can keep it in your hand, you can chew on it, and then you can use it as a snack. So
Right.
it's something that you can eat. But I think for a lot of people, this hand-to-mouth action is something that they miss a lot when they quit. And holding something in your hand is always a big help. It doesn't have to be a cigarette, just anything else to replace that. And then over time, you will get over that part of the habit.
I want to look at a study that was conducted, I guess, earlier this year in the journal Science.
Yes. This is a study that came out earlier this year. So they were looking at people who smoke cigarettes and people who vaped. So 43% of people who vaped had incidents of oral cancers and gum disease and issues with their mouth. 73% of cigarette smokers had the very same thing. So yes, we're seeing those numbers still a little bit higher with actual cigarette smokers. But as you said, the 43% for vapes, people who vape, it's almost at half. So it's creeping up there. And again, I just think there's a lot we know of that are included in vapes, but there are a lot of things that we don't know of also. And over time, I just think that's just going to continue to get worse and cause more issues.
For folks that live in the city of Quincy, certainly they can contact you regarding any tobacco-related issues.
Absolutely.
And we'll go over your number. It's been on screen as well. But for folks that will watch this beyond the city limits, because you do have an audience throughout the country, what would be your suggestion to them as far as connecting with either a local department or the Centers for Disease Control potentially looking for information kind of beyond what we talk about here?
There are a number of ways that you can find information on smoking if you're thinking about quitting. Here in Massachusetts, we have the Smokers Quit line, 1-800-QUIT-NOW. So you could call that number at any time. You would have access to online telephone counseling. So you have resources there that can tell you anything that's close to your area where you live that you might be able to get additional help. Outside the country, you have the CDC. They have a great website. They're a wealth of information about any type of health topics. So you can get information online. There are a number of smoking-related websites that are out there now, quite a few. And anytime that you are looking for more information, there's a lot of great sites that offer a lot of help. They have some geared towards younger people, and then they have some, the American Lung Association has a great site, the American Heart Association, American Cancer Society. So you can get a lot of information. It's very easy to find today.
You and I were talking prior to recording, and when we were talking about younger folks, younger people getting into smoking, there's peer pressure. Obviously, honestly, there's peer pressure often involved, but there's also the advertising aspect that companies will simply target that segment of the population.
They do, and that's been around for a very long time. I mean, we know years ago we had Joe Camel, which was a big cartoon character that was absolutely geared towards kids, and they had giveaways, things that they were giving out, and all of those things that were made to attract younger people. Today with vaping, it's the same thing. They're making them in ways that kids can hide them very easily. They're made in shapes, they look like memory sticks, they look like pens, they look like keychains. They have all these different types of vapes now that can be easily hidden.
Which adults wouldn't care about.
Exactly,
right?
exactly. But kids, being very cautious of the fact that they need to hide it, they find these vapes that are very easy to they can conceal them very easily. But I think with tobacco companies, they're always, when they're losing people with one product, they make up for it by coming out with something else. So the vapes, I think, even though we're talking about 20 years now, I think that they've been around. They're growing in popularity. I mean, we're seeing them in TV shows now and movies. And, when kids see these things, of course, they're just like it was back in the 50s, really, even. I mean, you'd see television shows and people and celebrities smoking. Younger people get attracted to that.
Right, they think it's the cool thing to do, right?
Right.
I know we talked about this as well in previous shows, the increased availability of another product, and that's nicotine pouches.
Yes, absolutely. Nicotine pouches are becoming quite popular with younger people. They are something that we're seeing a lot of right now. Whenever I'm out and about, I tend to see a lot of empty nicotine pouch containers, and kids are looking to get their hands on them because, again, they're something that they're used very easily. It's just a small pouch of nicotine that goes in between your gum and your cheek, and you can leave it in there. Nicotine gets absorbed. Some of them, because they don't contain tobacco, they can get away with having some flavors. So that's something that's been going on, and it's just become a big problem. There are a variety of brands of nicotine pouches that are out there now, and younger people are very attracted to them.
And again, the flavors are a big attraction. Do you think that the verdict is still out on pouches? I mean, they are so new. Do we know the health risks, all of the health risks involved?
I absolutely do. I think that we still need to, anything that's new, I mean, honestly, still e-cigarettes and vapes, and we're still, as I say, we're still looking at studies. Every week I'm reading something new about how a person's been affected by vaping. People who are heavy-duty vapors, they are getting issues with lung illnesses and things like that, ending up in the emergency room for one reason or another. So we're starting to see those stories. With pouches, we know for sure right now that they are definitely affecting the oral health, as we've been talking about today. I mean, you keep that pouch in there. Some of them contain small bits of fiberglass, so they can do a number on the inside of your mouth and your gums and your teeth. So I think over time we are going to learn more and more about them. But as you say, they're still very new.
Fiberglass, formaldehyde, it all sounds so bad.
Right.
It really does. If you just take a moment and concentrate on words like that, on additives like that, you would say, why am I doing this?
Exactly, exactly. I've often said to people when we talk about the chemicals that are included in cigarettes, and over the years I've said to people, if you walk around your own house and you just look under your kitchen cabinets or your bathroom cabinets and you take out any cleaners that you have, toilet bowl cleaners or mothballs themselves, or just any nail polish remover, anything like that. There are a number of things in your own home that you could find traces of those chemicals are being put in cigarettes. And they're certainly not things that you would ever think about eating or drinking. So, they're just very small forms of poison that are added to these cigarettes over time.
And I know they need to carry an ingredient list, but again, these containers are small. Therefore, the type is small. How many people actually pay attention to
Exactly.
the words?
Exactly. If you notice, if you go into convenience stores or gas stations that sell tobacco products now, there are large signs that they, over the last 2 years, have been required to post. It was from a lawsuit with some of the tobacco companies, and they're blue and black. I think you really can't miss them. They're really quite big, and when you walk in, they all have different messages on them about the dangers of smoking. So you'll see those in most of the convenience stores that you walk into. So they do have those out there now. I know if they probably had their way, they wouldn't. But this is something that they've been required to do, and it's a great, nice. Well, it's nice. I know when I come into these stores and I see these signs, and you can't miss them because they're of the size. But it's a warning right there for people.
And I guess really education is key, right? Programs like this. You had mentioned the internet. You had mentioned the CDC, the Centers for Disease Control. You mentioned the Massachusetts Stop Smoking
Right.
initiative. Just talk about, and it's great with the computer, all these are available, but equally, if you search on the computer and you're not searching smartly, you can find harmful information about continuing smoking, continuing vaping.
Exactly, right. And I think we might have touched on one of our last shows, Mark, about some of these influencers that you see online, the Instagram and TikTok and all of those things.
That's a new thing. That back in our day, there were no influencers,
Absolutely.
right?
That's right, I know.
With social media, that's a good point.
It's a whole thing with social media. It's become a dangerous place for younger people because you have a lot of people on there who are actually promoting these things. They're promoting nicotine pouches and vapes and things like that, which they're not supposed to be doing because many of these sites don't allow that. But every now and again, I think you have some of these people that can get away with it. And younger people see that, and they think, well, if this person is promoting a pouch or a vape, then I'm gonna try it myself. So we do have a lot of work to do as far as social media and fighting that all the time.
Well, again, that's why there are programs such as this one that helps to get the word out.
Absolutely.
And I certainly appreciate you coming in. We have come to the end of the half hour again, very heavy on information. Thank you so much.
Thank you for having me.
And I want to thank you at home for watching. Please continue to support the local access station in the community in which you reside. Please take care.